doc, just like me, that was in private practice in 2008. Okay. And I want to read the thing that I quoted. He said, in several decades of practice, it became clear that non-pediatric patients referred with the diagnosis of ear infections or sinus infections frequently had neither. And the origin of the patient's symptoms was determined to be TMD. Like, I read this and I was like, this is why I started this company, right? Like, this is so key. And he published this in the Archives of Otolaryngology, not some shabby journal, right? Like, this is legit. And what he found, that 75% of his patients with TMD, they may, or 74%, another study said 75, actually have oral fullness. Okay, so let's look at this patient who came in with ear fullness, and then we're going to take a little bit deeper dive. We're not too much longer, a little bit deeper dive into TMD. She came in, her chief complaint was that she was having fluid in her ears. She felt like there was fluid in her ears. And so I didn't see anything on her tympanic membrane. You can see that on both sides. And then I went ahead and I was checking for TMD. I was checking her temporalis muscles up here. It was kind of really tender. Was that it up there? Mm-hmm. And then her masseter muscle down here, was that pretty tender? Yes. So that shows me that she probably has some TMD. Up to 75% of patients with TMD will have ear fullness. So make sure you're checking that. Just to be on the safe side, we got tympanograms on both sides.